First I want to say congratulations to everybody. I know it's not easy going through something like this, and I promise it gets better. Just it doesn't ever seem like it gets better, but it does, so I promise it does. So yeah, as she said, I am a dad. I do have a 14-month-old son. It really does change your life for the better, so sometimes it might not feel that way, but it really does. It's a lot of fun, and you'll be surprised at how little sleep you really need to function, so it goes really well. So, first things first, whenever you're having a newborn, if this is your first one, your third one, your seventh one, however many you're going, you always want to know who's taking care of your kids. So you want to, find a pediatrician that you're comfortable with. There's different ways to do it. Obviously, family, friends. If you know someone with kids and you live close to them, you ask them, who's your pediatrician or who would you recommend? That's always a good way of doing it. Location is always important too. If you live on one side of the town and your family recommends somebody 45 minutes away, that's not always the best thing, because if your kid's got an ear infection or you want somebody to see them right away, it's kind of tough to sometimes manage that. But if there's somebody you really want to see and they're far away, that's okay to do too. And then the other thing is, if you're not really sure, or if you heard a couple different people, all of our offices especially do what's called a get-to-know-you visit. If you call the office and say, hey, we're having a kid and we want to kind of get to know this doctor or that doctor, you just call in and say, can we do a get-to-know-you visit? And what that is you come in, you sit down with us, and we just kind of just talk about whatever you want to talk about. You can ask us questions, we can ask you questions. If you just have concerns about things or you just want to get to know what our personality is, that's kind of what we do. And I think that's important, because you really want to be able to kind of gel well with your pediatrician, the kid, or the person who's going to take care of your kid for the next 18 years. You want to make sure that you get along, that you feel like you trust them and things like that. Because if you don't trust your kid's doctor, it's usually not going to go very well. So. Big things I will say at the get-to-know-you visits, to make sure you ask about if they don't bring it up, is the office hours. So it's always important to know what the office hours are like. Also what you do after hours. All the children's offices that we have is after hours, as we're associated with a nursing hotline that's strictly pediatric nurses. And so if you call after hours, well, they'll go to those nurses and they'll be able to answer a lot of your questions. They're great, they're awesome. But if they have concerns or they're not really sure, they page the doctor who's on call. So you're always going to get a hold of us if you have to. The other thing is to ask people, how is their practice associated? Obviously with children's, we are associated through the Children's Hospital. But if you go to different offices and do different get-to-know-you visits, you'll notice we do a couple little things a little different here and there, but we're all pretty similar in how we do stuff. And the other important thing is at least for me, when we were looking for obviously a pediatrician for our son, I knew the pediatricians, but for me it was important to find somebody who's board certified, because that means that they really focused on pediatrics and they know that, their training is really focused on taking care of kids. So, choosing a daycare, that's always a fun topic. Most kids you're not going to get to go to daycare until probably a couple months old or somewhere along those lines. Some will take you as early as 6 weeks, some a little bit earlier, some a little bit later. But I say if you haven't figured it out now and you know you want to do daycare, start looking now and start talking to them now, because some daycares have a little bit of a waiting list. The one for our son, we had to wait 6 months before he can get in there. And that was just because we moved and there was one closer to us and it was already into the school year and they were kind of on a school year basis, so we had to wait a while before he got in. So definitely start early, start looking, look often, those kind of things. If you're not really interested in doing daycares, then you don't have to worry about this. The other thing to look at is when you're choosing a daycare, what type of daycare is it? Is it center-based? Is it an in-home daycare? Or is it mainly a nanny service? All of these have their pros and their cons to them, so you kind of have to decide to yourself which one is better suited for you. Do you want something that's center-based where you know that it's affiliated with a certain kind of company or a group, or maybe it's a private group, but you have certified child care takers there. They are always going to meet certain ratio numbers and things like that, and they always have certain guidelines, and those are always important questions you want to ask. If you have an in-home daycare provider you know of or a friend uses that they really trust, if that's an option you want to do, that's something you can totally do, but I always recommend if you do an in-home daycare, make sure you do a good thorough background check, make sure they're certified in CPR and those kind of things. And the other thing is nanny services. I know many people that use certain nannies and things like that. It's just an option that's out there, and again, if you're going to do that route, just make sure you're doing your research. The other thing, again, family and friends. If you're not really sure about daycares, you don't really know what would be a good one, ask friends who have kids, ask friends who take their kids to different places and kind of get an idea of what the places are like and what they do. And the other thing, again, is location. If you're just are at a loss of what to do, just take your address and just kind of do a general search in a 5 to 10 mile radius and just kind of get an idea of what's close by. Then the important thing is what do you need? So, and I will tell you, if you haven't made a checklist yet, make a checklist, because you never know when things are going to come. Our son was born 5 weeks early. We didn't have a bag ready for the hospital. I will say if you don't have a bag for the hospital ready yet, no matter how far along you are, start planning it out and getting it ready now, because you never know when you're going to end up having to go over there. So car seat is important. You want to make sure you have a car seat. In the first 2 years of life, kids are going to be rear facing, so these are going to be rear facing car seats. There are some car seats that are convertible that you can get, but you want to make sure that it's going to be a rear facing car seat, and make sure you know how you put it in before you end up at the hospital, because that's the last thing you want to try to figure out when you get there, because I promise some of them are not that easy to put in. The other thing, making sure we have our crib or our bassinet set up. Again, like these things, like I said, make sure these are all set up before you end up going to the hospital. I'm going to get your waters here real quick. I know, super fun. So cribs and bassinets, making sure you have those. There you go. That's all right. No, totally understand.
Is that one?
Yeah, cribs and bassinets. So making sure you have those set up. I am one of those people that as soon as I get something in the mail or we pick something up, I built it right away, and my wife called me crazy. But the nice thing was, again, our kid was born 5 weeks early, so everything was prepared. So I always say just be prepared with it. Make sure it's set up. The things you want to know with your cribs and bassinets, make sure when you have the mattress, you don't have to have a Tempur-Pedic mattress for your kids. It doesn't have to be anything super soft. You want a firm mattress. And the reason why is because if you ever have the kids that end up flipping over on their stomachs in the middle of the night, you don't want anything too soft that kind of pushes into their face. Because if that happens and they're not able to get themselves out of it, you worry about kids suffocating things. So if you ever go out and you buy a mattress for your bassinet and your crib, they're all going to be pretty firm. You don't need to find anything super soft or anything like that. The other thing is when you are looking at the cribs and the bassinets, you want to make sure you get a sheet that fits it really well. You don't want it to be really loose or anything like that. You want it to be really firm and tight on there. So, and the other thing is no bumpers. I know bumpers are really cute. My wife bugged me about wanting to get bumpers because they matched all the rest of the theme of the room. And I told her you can buy them, but they're going to sit in the closet for a while. And so the reason we don't want to do bumpers is, again, there are ties and things like that where if the kid were to somehow roll into it, they can get stuck into it and can harm themselves. So that's one of the main reasons we don't like them. The other thing is feeding supplies. So kind of getting an idea of how you want to feed. If you're going to breastfeed, great. If you're going to do breast and formula, cool. If you're going to breastfeed and pump, awesome. If you need bottles, make sure you have a lot of them, because you're going to go through a lot of them and you're going to be cleaning a lot of them. And if you're like me doing the dishes, you're going to clean a lot of bottles. So make sure you have a lot of them. 2 or 3 probably is not going to be enough. But make sure you have your supplies or have an idea of where you're going to get supplies early on, and make sure you're kind of prepared for that stuff too. And the last thing is, well, not the last thing, but one of the other important things is making sure you have enough diapers and bathing supplies. Kids go through diapers very quickly. You will be surprised at how many diapers you buy. If you're still planning on having any baby showers, just ask for diapers, because you're going to go through a ton of them. It's really one of the big things you're going to need. Bathing supplies too are important, making sure you kind of have all that stuff set up, because again, you want all this stuff before you go home. Because once you're home, you're kind of on your own with trying to figure this stuff out. And trust me, you don't want to have to go out and buy this and buy that when it's 2 in the morning and you're missing something. So now what do? It's time, baby's coming, what are we going to do? So making sure you got supplies ready. So making sure you got mom and dad supplies, clothes, bathroom things like that. Make sure you got a camera or phone or both, because they're all kind of the same thing nowadays. Maybe a laptop too, to kind of pass the time there. A lot of the hospitals too will have DVD services, things like that. They'll come by and say, hey, do you want to watch a movie or something? And they'll bring you something. But make sure you have something to entertain yourself, because although you'll be wanting to get a lot of sleep, it can get a little bit boring sitting in the hospital for a while. So you want to make sure you got something to entertain yourself. Make sure you bring the car seat with you, because you want to make sure you have it, because you're going to be taking the baby home in the car seat, and you're going to want to make sure you know how to use it, make sure it fits in the car. And sometimes, depending on how early the kids are born and things like that, they might have to do some certain car seat studies to make sure the kids fit in there okay, that they breathe okay in there, and they're not having any issues. Make sure you have lots of outfits. Some hospitals will offer photography services in the hospital. So if you want to, after the baby's born, the day that you're going home or the day prior, they'll have a photographer come around and say, hey, do you want to get newborn pictures? So if you want to do that, make sure you have an outfit or two for those types of things. The other thing is make sure you have a going home outfit. If you want to make it really cute and awesome and things like that, you can do that, but make sure it's weather appropriate. So if it's going to be rainy outside, make sure you know that it's going to be rainy outside. If it's going to be cold, make sure it's warm and it's not just shorts and a t-shirt type of thing. So that's always important too. And then checking in. Whenever you get to the hospital, they're going to ask you, who's your kid's pediatrician going to be? And you can let them know. Usually, if you've done a couple get-to-know-you visits and you weren't really sure, but you've kind of figured out what you want to do now, all you got to do is, when you get there and they ask you, just give them a name. You don't have to call an office ahead of time or anything like that. Once you tell the hospital who your pediatrician is going to be, they will contact that pediatrician and let them know, hey, these people have chosen you as their pediatrician, their kid's born or it's going to be born, things like that. So you don't have to worry about trying to plan all that stuff ahead too much. So in the hospital, what's going to happen? Baby's finally born. You've done all the hard work. Initially, what we're going to do and what the nurses are going to do, they're going to do a couple initial assessments with the kid. They do something called APGAR scores. I don't know if anybody's heard of that. If you have, you can raise your hand. If you haven't, that's cool. So APGAR scores is basically just a basic scoring system. At 1 minute and 5 minutes, we kind of just assess how are they looking. You know, what's their heart rate like? What's their breathing like? What's the color? What's their skin look like? Are they really active and crying and things like that? And that gives us a general idea of the health of the baby and how well they're doing. Typical APGAR scores, the highest you can get is a 10. I'll tell you, not every kid gets a 10, and that's totally fine. The last thing that usually happens is their hands and feet tend to still be a little blue, and that's totally normal. After a couple of days, they tend to get pink, so that's fine. So if we're day 2 in the hospital and your kid's hands are still blue, that's totally normal, and that's okay. The other thing is they do what's called a gestational age exam, basically just making sure, looking at the kid, do they look to be about the same number of weeks that they were guessing that they were. So if we're born at 39 weeks, they should be somewhere between 38 weeks and 40 weeks doing the exam. But you'll be surprised that sometimes you'll have a kid that says, oh, this kid's a term kid, they're 40 weeks. And then you do an exam and they're like, this kid's probably closer to 36 weeks. You can definitely kind of miss that stuff. So, and that's just trial and error and kind of the ability for being able to doing the ultrasounds and kind of assessing kind of the size of the baby. Sometimes it's accurate and there's rare times that it's not, and so that happens sometimes. So that's why we do those kind of exams. In terms of the nursing assessments right after a baby's born, there's a couple things they will do. The vitamin K is an injection that they do right after the baby's born. Vitamin K is important. It helps with clotting of the blood. There's a rare condition that sometimes babies are born with a vitamin K deficiency. And if they have that, they actually can bleed. And they can bleed from anywhere. They can bleed in the brain, they can bleed in the GI system and the intestines, things like that. And you don't know the kid has it until after they're born and they're bleeding. So what we do now is every kid, when they come out, we do give them this vitamin K injection to help prevent that from happening. It's a vitamin. There's nothing else specific with that type of shot. It's specifically that vitamin to help with that kind of clotting system. The other thing is they use an eye ointment. That's to help protect against certain infections that you see in newborns early on. So they kind of put a little goop in both eyes, and that's kind of it with that. While you're in the hospital too, they'll be checking the kid's vital signs. They'll check his blood sugars. Some kids are born and have a hard time managing their blood sugars. So if you are a mom that maybe has problems with gestational diabetes or some other things like that, they might have a higher risk of having problems with their blood sugar, so they might check it a little closer. But again, that's one of those things that we kind of see how the baby's doing, and we'll kind of determine how frequently we do that or how often we need to do it. We always do a hearing screen in the hospital before you go home, make sure baby's hearing's doing okay. If for some reason that hearing screen doesn't pass, then we refer you to an audiologist. And an audiologist is just somebody who specializes in hearing, and we'll do a more kind of specialized test to kind of really focus and make sure that we're not having any issues with hearing. We also do a newborn screen. The state newborn screen, we're checking for a bunch of different kind of diseases that you can't really find just looking at the baby initially. So they'll do just a little heel poke, take a couple little drops of blood off the heel. I know I'm doing my palm, but I don't want to lift my foot up. And that takes about 4 or 5 days to come back. And once we get that back, we'll know if there's any concerns like cystic fibrosis or sickle cell anemia and some things like that. And the other thing is jaundice. I don't know if you guys are familiar with what jaundice is. Raise your hands if you've heard of it. Maybe, maybe not. Jaundice is that yellowing of the skin that sometimes babies have. And some kids are at higher risk for it than others. So what they'll do initially when you're in the hospital, before you go home, usually the night before you go home, they'll do kind of a scan on the head and get a general idea of what number that is. If that initial test seems a little higher than we like, then they'll do another little heel poke and draw some blood and look at it that way. Depending on what those numbers look like, kind of determine what you do with that, but we won't get too far into that right now. And the other thing is we do daily exams. So every day that you guys are in the hospital with the baby, your pediatrician comes in and sees you and that baby, making sure feedings are going okay, making sure baby's healthy and okay, and making sure you guys don't have any basic questions that you want to ask or concerns and things like that. So that's another thing I always recommend is when you're in the hospital, have a notepad there, because you're going to come up with some random questions in the middle of the night and you won't remember it the next morning at 6 a.m. if your doctor shows up at that point. So make sure you write down questions so when they come and they see you, you know what to ask for and you can ask them about it. So there are some special considerations when you're in the hospital. Are you going to breastfeed? Do you want to bottle feed? Things like that. You're going to hear lots of opinions from a lot of different people. For me, I think it's important for you to know what's important to you. If you really want to breastfeed, that's awesome. If you're really not interested in it and you want to do formula feeding, I'm not somebody that would push you into doing one way or the other, and you shouldn't be made to feel guilty to do one way or the other. Really, you guys are the parents. You are the ones that are going to be feeding your kids. Obviously, we love breastfeeding. Breastfeeding is great. It has all the great nutrients in it. It has some protection in it with antibodies and things like that, and we love it. But we're never going to be someone that's going to totally push you into that if that's something you really aren't passionate about. So I think before you get to the hospital, make sure you know what you want to do when you get there. But if you are breastfeeding, there are some questions that are good to ask and good to know. One is when is my milk going to come in? You'll notice if you're breastfeeding the first couple of days, you feel like baby's just not getting anything, and if you've never done it before, you might be concerned that the baby's not getting enough nutrients. Totally normal. So the first couple of days, you're only going to probably produce 15, 20 milliliters of breast milk. That's totally it. And that's okay. That's all a baby needs. Really, breast milk tends to come in about the third or fourth day. So really, if you want to breastfeed, make sure you're trying to do breastfeeding every 2 to 3 hours. That extra stimulation is going to help you kind of produce that extra breast milk and help that milk come down and really help with that. There's going to be that question of, okay, well, I'm breastfeeding, I really feel like my milk's not coming down as quickly as it is. Should I supplement or not? That's going to be another question that you should have with your pediatrician. You can ask the nurses at the hospitals too. Most of these hospitals, most of the nurses are basically like lactation consultants, so they can help you with a lot of that kind of stuff too. If not, though, we do have lactation specialists through Children's as well. So if there's always these questions and concerns with breastfeeding, or if you want to just kind of follow up with somebody, kind of work on breastfeeding, different techniques, things like that, there's always that option as well. And then the last thing, obviously, is the pacifier. Do I use a pacifier? Do I not use a pacifier? Well, I want to breastfeed, but I don't know if I want to use the pacifier for that. Again, you're going to get a lot of different opinions on this. I'll say there are some studies that show if you're breastfeeding and you use the pacifier, it might affect their feeding in the first 2 weeks, but then there's other studies that say that's not true. And so it's hard to really pick studies that say specifically, yep, this is the exact obvious evidence that's going to happen with this. So again, for me, it's if you want to use a pacifier, use a pacifier. If you don't want to use a pacifier, don't use the pacifier. To me, it's as simple as that. Other things, circumcision. Again, this decision is totally yours if you want to do circumcision or not. So if you know you're having a boy, I suggest thinking about this before you get there. There are some, risks and benefits to circumcising. The risks really are just you do the circumcision, and if they have an underlying bleeding disorder we don't know about, they bleed more. Usually, if they bleed more, then we know they have an underlying bleeding disorder, and you can pick it up. That's really the main risk with it. In terms of pain and things like that, probably the most pain that they're going to have is just from the numbing medicine, and that's it. Kids do incredibly well with things like circumcisions. The benefits to it, there used to be a lot of discussions that it would help reduce the risk for cancers and things like that. All the new studies show that that's not true anymore. But what it does do is it helps reduce the risk for urinary tract infections and infections later on in life, like STDs and stuff like that. So that's the main benefit from getting a circumcision. It helps really reduce that risk for things like that. Because really what happens is that foreskin just holds on to a lot of that bacteria and stuff. So again, it's totally your decision if you want to do it or not. If you decide to do it, there are different people that will do it. Really, in today's day and age, mostly it's going to be the OBs that do the circumcision when you're in the hospital. Really, just the way they've kind of changed training for pediatricians and docs and things like that. Really, they've really focused on the OBs doing it now. I work with a couple of older doctors who have been out for a while, and they used to do a lot of circumcisions, but they haven't probably done them in the last 10 years, just because it seems like the OBs that's kind of where their training has gone and things like that. So that's what we expect if you're planning on doing that. The kid will give them Tylenol in the first 24 hours just to help with any pain that they might be having. In terms of cleaning it, taking care of it, really there's not a whole lot you have to do with it. There's going to be a kind of basically a gauze or you want to call it a Plastivil or something like that, that will be kind of on it. But in terms of taking care of it, really the most stuff you have to do is put some Vaseline on the inside of the diaper. Do that for the first week afterwards, and it helps keep that circumcision site from sticking to the diaper so it doesn't pull off any of the scabbing or anything like that. Otherwise, it's just kind of basic kind of care. Some swelling is normal. It's going to be very red and raw. It might look really weird to you if you've never seen it before, and that's okay. If you ever have questions about it, make sure you ask somebody about it. Make sure all your questions are answered before you go home. You can get sometimes a little yellow-colored film there as well. Again, that's totally normal. That's just part of the healing process. So we're ready to go home. Well, the big question is, when can I go home, Doc? I want to go home. I really want to go home. Things just to kind of know when you can go home. If we're having a normal spontaneous vaginal delivery, we're not doing a C-section, usually you'll be in the hospital about 2 to 3 days. That's making sure you're recovering well and making sure baby's doing okay, not having any issues. If it's a C-section, you actually usually stay about a day longer. Usually that's because, one, mom takes a little bit extra time to recover, but also, two, with babies with C-sections, they actually have a higher risk for some breathing problems and things like that. So we tend to watch them at least another day longer to make sure they're doing okay with everything. There are those options about 24-hour discharging. A lot of people want to just get in, get out, get done type of thing. As a pediatrician, we don't recommend it typically. And the main reason why is because there's a lot of things you don't see in the first 24 hours of life. We talked about jaundice and things like that and having a high bilirubin level, which is part of jaundice. If a kid has jaundice in the first 24 hours of life, that's usually a problem with their anatomy. Most of the other forms of jaundice that you typically see in kids doesn't happen until after 24 hours of life. So you can miss a lot of that kind of stuff. Different heart murmurs and problems with feeding and things like that don't occur in the first 24 hours of life, and you don't notice it. So that's why we typically will recommend waiting that extra day. So. The other thing that can happen too, depending on how your kid's doing after the hospital, sometimes the pediatricians will recommend having a home health visit afterwards. Maybe the baby's born a little bit smaller than normal, or maybe baby lost a little bit more weight in the newborn nursery than we like. And babies will lose weight initially, so don't be scared about that. Babies will be born, they'll have their birth weight, and the next day they're going to be down. They're always going to be down, and that's totally normal. We let babies lose about 10% of their birth weight, and that's totally fine. After 10%, we start to worry about dehydration and things like that, but losing a little bit of weight, it's okay. But if baby starts to lose too much weight, or we're worried about how high their bilirubin levels are, sometimes we can set up nursing visits to come out to your house and make sure the weight's doing okay, make sure feedings are going okay, and things like that. But again, that's all situation by situation basis. That's not an automatic. That's going to happen every time. So then the question is, we're home. What do we do? When do we go see our doctor? Typically, it's going to be about 1 to 2 days after discharge. And the reason why we do that is we want to make sure, again, that weight's not dropping too much, because we can still see some droppage of the weight at that point. We want to make sure if there were problems with jaundice, it's not getting worse. If there were problems with feedings, that's not getting worse. And to make sure, see how the sleep schedules are going, making sure that baby's getting the sleep that they need, but isn't sleeping too much. You know, babies have 3 jobs. They eat and they sleep and they poop. So we want to make sure those are all going okay. After that visit, as long as things are going well, the next visit is usually around 2 weeks old. And we do 2 weeks old because we expect babies to be back to birth weight by then, so we want to make sure we're gaining weight like we should. Usually by that point is when the umbilical cord falls off, so it dries up and falls off. You don't have to do anything special for it. You don't have to rub alcohol on it or anything like that. It falls off on its own, so you don't have to worry about any of that kind of stuff. But we like to make sure that it's come off at about that time. It might come off in the first week. That's totally fine and normal. But if it's taken longer or it's not drying up like it should by that point, then we have to look into other things and what might be causing that to happen. Other things we'll do, there are some kids that may or may not need to get an ultrasound of their hips. That's all completely situationally dependent. Kids can be born with what's called a hip dysplasia. And what that means is, for some reason, a baby's hip did not form the way it's supposed to. So if you have the kind of your femur, and this is the head of the femur, and this is the socket of the hip, it's supposed to kind of sit in there nicely. And as the baby sits inside mom, that kind of molding happens, and that bone pushes on the socket, and it's supposed to kind of form a nice little pocket there. If the baby's in a breech position, or if this is mom's first baby and it's a female, they have actually a higher risk for hip dysplasia too. And they think it's because maybe slightly higher hormone levels like estrogen and things like that. They're not 100% sure, but they see kind of a pattern of it being a female firstborn, but also if breech position is definitely there, or if there's a family history of it. So if you know that either you or your spouse had a problem with your hips at a young age and as an infant, that's definitely something you want to let your pediatrician know, because we'll want to probably get an ultrasound in just to make sure that socket looks okay and that hip looks okay. If you don't, it can really affect the development of the hip and things like that later on in life. And again, then immunizations, that's always a big question parents have. On the first day when baby's born, we do give a hepatitis B vaccine. If that is not something you want to happen, make sure you let people know that before the baby is born, because typically if you haven't said anything about that, that's something they'll assume that happens, or in the paperwork when you fill things out, usually they'll ask you for that, but make sure if that's something you don't want to happen at birth, ask for that. We do recommend doing it though. They have done a lot of studies looking at this and why we do it, and if you guys have questions about it, you can definitely ask me afterwards and we can talk about it more. I don't want to take up too much time with too much medical jargon if we don't have to. But typically, other than that, the next round of immunization starts at 2 months old. So, then there's the big concerns about infection. What if my baby's sick? How do I know if my baby's sick and things like that? Obviously, first thing is anybody who's going to touch your baby, make sure that they're washing their hands. Even if they look healthy, they're fine. They've been helping you all day. If you're going to pick up baby, hang out with baby, wash your hands. Try not to travel, especially in the first few weeks of life with baby. Their immune systems are still pretty immature, even if you're breastfeeding. Their immune system's going to take a while to kind of really pick up. Really, baby's immune system isn't really kind of more mature until about 3 months old. So those first 3 months, they're pretty prone to infections and things like that. So we try to limit it as much as possible. Now, if you want to go traveling at 2 months old, that's okay. Usually it's those first few weeks we really want to be cautious, but just kind of letting you know. Big things that we are concerned about. So like I said, babies through 3 things. They eat and they sleep and they poop. So eating is a third of what they're supposed to be doing. If they're not waking up to eat, if they're going 6 hours, 8 hours, and they just don't care about eating, they're just completely lethargic and tired, and you try to feed them and they just don't care, that could be a sign that they're sick. So that's a sign you want to call their doctor right away. Other things, if they're completely inconsolable and screaming and irritable, and you've tried everything and you're going 4 or 5 hours on now and we're still screaming our head off, that could be a sign there's something wrong. Fevers are always scary in babies less than a month of age. So if your newborn's less than a month and they feel really warm and you check a temperature and it's greater than 100.4, that's something you want to call your pediatrician about right away. Like I said, babies' immune systems are really immature, and if they have an infection somewhere, it can spread very quickly. Another sign is actually babies can drop their temperature too when they're sick. So they might not be able to mount a fever because their immune system's so immature, their temperature might drop. So if they drop and they don't seem right and you check a temperature and it's low, we want to know about it too, okay? So feeding, how often should I feed? That's always a good question too to have. If you're breastfeeding babies are going to want to feed usually about every 2 to 3 hours. Some kids, especially in the first couple weeks of life, will cluster feed a little bit. So you might notice at nighttime they're eating every hour, and then during the day it's like every 3 to 4 hours. That can sometimes happen, but typically breastfeeding babies are going to feed about every 2 to 3 hours. That's good for you too, because that's getting that stimulation to help with that milk production. So it can get exhausting sometimes, but stick with it if that's what you're planning on doing. Formula-fed babies tend to feed a little bit less frequently. They feed about every 3 to 4 hours. One of the main reasons why formula-fed babies tend to fill up a little bit quicker with formula. And the other thing too is when you look at the curdling of the milk, breast milk doesn't curdle as much as formula, so when it gets into the stomach, it goes through the stomach a lot quicker, whereas formula kind of sits in the stomach for a while, so it makes them feel fuller a little bit longer, so they don't eat as often. The other thing is if you're getting bottles, there's always things to consider. When you're getting them, make sure you get a nipple that's a slow flow nipple. And they'll say on there, most of the newborn bottles will come with a slow flow nipple. It'll say level 1 or something along those lines, and it'll say slow on it. What that means is just whenever they can drink, it only lets a certain amount through, because when babies are still young, they're still kind of learning how to eat pretty well. And if it's too fast of a flow, they can really kind of choke on it and gag on it, and they can potentially have risk for aspiration and things like that. So you kind of want a slow flow nipple for those. Some babies are great eaters. They're awesome. They come out 3 days, 4 days later. They're doing a slow flow nipple and it's just not moving fast enough for them. If your baby does that, you can definitely kind of change nipples around or talk to your pediatrician about changing that up, because some babies just do really well with a medium flow nipple, so it just kind of depends. The other thing is bisphenol A. I don't know if you've heard of that. That's that BPA thing. It's basically is a plastic that is used in some productions of plastics, and there's some concerns that it might get into foods and drinks and stuff if it's part of a bottle. So typically we recommend if you're getting a bottle, try to get a BPA-free one. If you don't, it's okay. Because according to the FDA, there's no concerns, but usually that means just there's no studies that have shown there is a problem. So usually if you can find a BPA-free one, get a BPA-free one. Now spitting. Spitting's always a fun question. So spitting is very common in babies. If your baby spits, that's okay. That's totally normal. It's actually part of their anatomy. They're not able to keep things down as well as we are as adults. Totally normal. So kids will spit. When you burp them, they spit, and it's completely fine. Ways to reduce the amount they spit or how frequent it's happening, making sure you're not overfeeding. Now, if you're breastfeeding, it's a little difficult to overfeed with breastfeeding, but you definitely can if you have a really large supply of breast milk. So you kind of have to watch that. Formula feeding babies, definitely, it's very easy to overfeed formula fed babies. And the reason why is because they'll just get a hold of it and they'll just guzzle, 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 guzzle. But their stomachs are so small, once you hit a volume point, not enough can get through and it just comes right back up because it has nowhere else to go. So the other thing too is if you have a kid that tends to spit a little bit more often, make sure you're burping a little bit more frequently. And if they're really a frequent reflux or frequent spitter, try to burp them about every half an ounce if you're doing it from a bottle. If you're doing it with breastfeeding, you can do it about every 5 minutes or so. But that just helps kind of move the air out. Really what spitting is you're getting air into the stomach because they're gulping down so much air and it pushes everything back out. So if you can burp them a little bit more frequently, that tends to help. Other things like tobacco smoke and other irritants can make them a little bit more prone to spitting, so try to avoid that kind of stuff too. So if you are a smoker, obviously I recommend quitting, but if it's not something you're interested in doing, make sure you're wearing a clean outfit when you're holding the baby. Make sure you've washed yourself up and things like that, because even the stuff in your clothes can affect the baby. So whenever babies are spitting, though, there are some worrisome things that we get concerned about. Is the spitting projectile? So projectile means it really does kind of shoot across the room. It's kind of like The Exorcist. So you'll know it if you see it. It does happen from time to time, but if this is something that's frequently happening, we want to know about it right away. Other things, if there's ever any blood in it or a dark green color. You can have a little bit of a yellowish green color. That's normal kind of stomach acid, but if it's a dark green color, that can be a sign that there's something else going on. Other things, poor weight gain, they're inconsolable, crying, fussiness, not wanting to eat, or if they're having breathing problems, those are all things we'd want to know about because that could be a sign that it's more than just simple spitting. So, pooping's fun to talk about. If you like talking about pooping, become a pediatrician because you do it every single day. Starting out, normal poops for babies are what's called meconium. It's going to be in the first couple days that they have this. It is this dark, tarry looking stuff. It looks kind of weird if you're not used to it. I will say, dads, if you're not used to changing diapers, do it with this. And the reason I say that is because this stuff is sterile. There's no bacteria in this. This stuff's been sitting inside babies. So it's the cleanest poop you're ever going to clean up, so you might as well clean this stuff up. After a couple days, once we're feeding well and things are moving through, it's going to become kind of a different color depending on what you're doing. If you're breastfeeding, it's going to be kind of that mustard-colored stools that people will talk about. It'll have the mustard seeds look into it, and that's totally normal. Breastfed babies, when they're pooping, you can have a wide range of frequency of how often they poop. They can go 8 to 10 times a day because milk has a natural laxative in it, so that helps with pooping. Or they might not poop for a week, and that's totally normal. It doesn't mean they're constipated. The thing with breast milk is it's basically, like I said, it's what the body needs and not what the body doesn't need. So the body absorbs all it needs, and whatever's left over is what you poop. So if there's not much left over, you're not going to poop very often. So as long as babies' poops are normal, there's that nice yellow soft stool, and it's still only once a week, that's okay. Lucky you're not having to change a lot of poopy diapers. Now, if you're formula feeding, they're going to probably be more of like a tan color, but you can have a little bit of difference depending on formula. Sometimes they might get a little green from time to time. They might tend to change colors that way. Obviously, if there's blood in there, we want to know about it. But they can be firmer, and you can have up to 4 or 5 times a day. Might be more, might be less, but formula-fed babies tend to have that frequent daily poops that you're going to see. Grunting is normal. That's the baby trying to learn how to poop. Sadly, when we're born, we don't know how to do it, so we have to learn. But like I said, if you ever have blood or mucus in it, or you have really hard balls of the poop, we want to know about that, because that could be signs that we're having problems with either the formula or we're getting constipated and things like that, so we'd want to know about it. SIDS is an important topic. You will hear constantly more and more about this as you get into the hospital, and when you're in the hospital, you'll have to watch some videos on it too. If you're not familiar with what it is, it's sudden infant death syndrome, and what it means is basically you have an infant who suddenly dies for no reason that you can apparently say. Things just stop working. Usually it's less than a year of age. More commonly, it's going to be between the 2 and 4 months. Really, if you look at the studies, the highest risk is up until about 3 months old, and then it starts to taper off a little bit. But when you look at the numbers, really between 2 and 4 months is when you see it. It is the leading cause of death in infants between 1 month and 1 year of age. Why it happens, we're still trying to figure everything out. But what we do know is there are some things that help reduce the risk for it. Back to sleep, if you haven't heard about that, basically it's when baby goes to sleep, lay them on their back to sleep. A lot of people worry about, oh, what happens if they spit up? Are they going to choke on it? The nice thing is we have this great reflex that if we spit up, our epiglottis shuts down on our windpipe, and it doesn't let anything in our lungs. So I don't want you to worry about anybody with that. And the nice thing, too, is everybody worries about the gravity of it. Our esophagus sits behind our windpipe, so if there's gravity issues, it goes right back down our esophagus, so that's good. Whereas if they're laying on their stomach, it actually can go more likely into the windpipe. So that's why we like back to sleep. Again, having the firm mattress. And the other thing we always say is nothing but baby. So when you have the bassinet in the crib, you don't need stuffed animals in there. You don't need pillows. You don't need blankets. You don't need wires from your monitors going through there. It just needs to be baby. That's it. You don't need anything else. Really, if you look at blankets and pillows and stuff, you really don't even need that until about 2 years old. So you don't need to worry about any of that kind of stuff right now. Smoking can potentially increase the risk for SIDS. Pacifiers actually have been shown, kids, if they sleep with a pacifier, might actually reduce the risk for SIDS. Doesn't mean you have to go get a pacifier all of a sudden if you weren't planning on doing it, but there's some studies out recently that have shown if kids sleep with it, it might actually reduce their risk for it. Overheating is a big thing too. You'll notice when baby's born in the first couple days while they're at the hospital, we're going to bundle them up, put on a hat, put on gloves, all that kind of stuff. And that's really to help the baby's body learn how to regulate its own temperatures and things like that. But once they go home, their body's more than capable enough to regulate its own body temperature. So you don't have to bundle them up when they're at sleep at night. All you need is just a light sleeper. If you want to put a swaddler on it, that's it. You don't need heavy blankets. You don't need hats, things like that when they're sleeping. Increasing their body temperature like that can actually increase their risk for SIDS. So that's something to be concerned about. Again, things like monitors and things like that. If you're going to have a home monitor, like a video or an audio one, don't want it sitting in the crib. You don't want any wires running through it. Have it off to the side to where it's working, but it's not impeding with the sleeping area. And the other thing is tummy time. Tummy time is actually a good thing. So when baby's awake with you, and you can do this as soon as you get home if you want to, have baby lay on their tummy while they're awake. And that really helps working on neck control, head movements, being able to lift the head and move it around. And you want to do that about 15 minutes a day. It doesn't have to be all 15 minutes at once. If they don't really like doing it, you can do 5 minutes here, 5 minutes there. But you want to kind of do that during the day and trying to help with learning to use those muscles. So crying and baby noises. So crying is always the fun thing. And you might hear people tell you, don't spoil the baby, let him cry, let him cry, let him cry. Well, in the first few months of life, especially the first 3 months, you're not going to spoil your baby. So if your baby's crying, you want to hold your baby, hold your baby. It's actually pretty comforting. Then the question you got to ask yourself is, why are they crying? Are they hungry? Is it about that time to feed them? Okay, let's try feeding them. Are they just really tired and having a hard time falling asleep? That could be part of it too. So try, if you want to do music, singing, car seat, riding in the car, all that fun stuff, whatever seems to work, you can try those things. They might be uncomfortable. Are they gassy? Do you need a diaper change? Things like that, that could be a sign of it. Or are they just really bored? Have they just been sitting there and they're just like, seriously guys, hang out with me? Interact with them a little bit. Play with them, read to them, talk to them. Any of those kind of things that kind of interact with them, that might be all they need. Big thing always, never shake a baby. I'm sure you guys have heard of shaking babies, and if you haven't, you'll hear about it more when you're in the hospital. But any kind of rapid movements of the baby, movements of the head can actually cause the brain to be damaged, cause it to bleed, and cause massive problems, including death in babies. So, and it doesn't always have to be shaking. It can be throwing them onto the crib. It can be hitting them against the wall. It can be anything that causes that head to move quickly and stop. So that's always a big concern. So obviously, if you're getting frustrated, if baby just doesn't seem to want to respond to anything you're trying to do with crying, lay him down and just kind of take a step back. Crying's not going to kill the baby, but shaking will. So if you just need a little bit of break, 5-10 minute break to get a mental check, step out of the room, let them sit there and cry, and then walk back in, collect yourself, and you'll be good. Then there's normal movements for the baby. So there are some reflexes, and you'll see us do this in the hospital too, and we can talk more about that when you're in the hospital with your pediatrician, kind of what the reflexes are. But there's different ones we're going to look for. Babies do cross their eyes. That's totally normal. They'll do this up until about 6 months old. So if baby's eyes are going every different direction, totally fine. You will have some random jerking movements, especially when they're sleeping. That's normal. That's kind of their nervous system developing. But if it's only happening on one side, or if one side's not moving, or if the movements are rhythmic and they won't stop, and the big way to check is if it's moving and you try to stop it by holding your hand on it and it doesn't stop, that's probably a sign of something more than just something minimal. We want to know about that right away. The other thing is if they're really stiff or really floppy too, that could be a sign that there's a problem. Bathing, you can do it 2 to 3 times a week starting out. You don't have to do a lot of bathing early on. It doesn't have to be every day. Some people only do it once a week. It's really up to you and how their skin is. Sometimes if they have really sensitive or dry skin, you don't want to overbathe them because that can dry the skin out more. So this is going to really be dependent on the baby and you in terms of what you want to do. But really 2 to 3 times a week is definitely enough in the beginning. Making sure your water temperature is set. So if you haven't done it yet, find where your hot water heater is in the house and set the max to 120. Because you don't need it any hotter than that because you don't want to accidentally burn your baby. So if you haven't done that yet, I would recommend doing that. We do sponge baths until the cord falls off because we don't want to submerge them with this cord. So really that's just having them, if you don't have a bath yet, get one. It'll have a little kind of thing for them to sit in. They'll have the water underneath and you can just kind of sponge them off real quick, and that's all you really need to do with them. Like I said with the umbilical cord, just keep it clean and dry, and it'll fall off. Like I said, you don't have to put anything special on it. Big things you want to watch for are signs of infection. So does it get really red? Is there really like a nasty, foul-smelling discharge to it or anything like that? You might get a little bit of a smell with it, and sometimes that's just the body's immune system trying to disconnect it from the body, and that's normal. But if you've got a really nasty discharge, look at it, you're just like, well, that's smelling really weird. Have somebody take a peek at it. And then the other thing is trimming the nail. So they have very sharp nails and they grow, it seems like, every single day. You can use a nail file during the first few weeks, and the reason we say a file instead of using clippers is because sometimes if you use the clippers, it can bend the nail a little bit and mess with the nail bed. So if you have like a file, you can do that. Or if you have really, really fine scissors, you can do that too, but you don't want to really do anything else. And usually I recommend wait till they're asleep because it's really hard to hit a moving target. Other things, newborns are born with rashes, and sometimes they get rashes a couple days later, so that's totally normal. There's a couple of them that are normal. You see the first one, and it has the word toxic in it. I don't know who came up with this name, but that's crazy because you see toxic and you get scared, but it's actually a totally normal newborn rash. So don't be concerned if someone says, oh, your baby has erythema toxicum. That's a totally normal newborn rash. They can get acne. They can get something called milia, which are these little white dots on the nose and around the nose, so that's normal. Kids get cradle cap, which is that scaly, dry skin in the scalp. That's totally normal, and you can talk to your pediatrician about how you want to mess with that and handle that. And then kids get diaper rashes. They can get regular diaper rashes. If they get diarrhea, you can get really red and raw skin. Sometimes they get little yeast infections down there too, and that's totally normal in the diaper area. And so there's different ways to treat those things, and you can talk to your pediatrician on how you want to manage those. Another thing is that some babies are born with blocked tear ducts. So your tear duct is right here in the corner of your eye. There's a little hole there, and it drains from your eye into your nose. And it's just supposed to be this little opening. Some kids, it's not blocked. It's just small and tiny, and it takes a little bit of time to open up. So those kids, every time they go to sleep, they'll wake up, and they'll have some drainage in the eye. They'll have a little mattering, some yellowy stuff. But the eye looks nice and white the way it's supposed to. There's no swelling, puffiness, things like that. And that's pretty typical for these tear duct problems. Kids with blocked tear ducts, though, they don't get better. The kids with the small ones do. And so if we're at a year of age and things aren't any better, we usually have you see an eye doctor, and they actually can help open that up. So Concerns though is when they have those blocked tear ducts or the small tear ducts that aren't taking time to open up, they can still get infected. So we always want to watch for redness. Redness is always a big sign for possible infection. Excessive drainage, so that really, really purulent, nasty drainage that just keeps coming. Or if there's any swelling around that area, that could be a sign of infection. And I think that's everything because it's not wanting to move any further. Yeah. So, with all of that information, do you guys have any questions? I know that's a lot of stuff.
Might sound stupid, but is there a set temperature for your house you should have it set at? Or?
I wouldn't say there's a set temperature, but you usually don't need to overheat the house. I mean, usually keeping it around like the 68 to 70 area is totally fine. You don't need to bomb it up to 75, 76, 77 in the winter. You don't need to pop it down to 60 in the summer or anything like that. Really, it's just kind of making sure things are kind of, just keeping kind of a comfortable temperature. Anything else? Cool. Well, like I said, it's a lot of fun, so congratulations again to everybody. Really, you really don't need to sleep. It's just incredible how much little sleep you really need to have. Our son's almost 15 months now, and we still don't sleep, so it's okay. But that's more our choice than his. But yeah. All right.